And here we go. We are live again. Welcome back, Greg.
Hey, welcome.
We're here on Healthier Ever After. We're going to talk about some interesting non-weight loss benefits of GLP-1 medications, I think, tonight, right?
Yeah. We both really like this topic. We talk about the non-weight loss benefits of GLP-1s all the time amongst ourselves. And we're like, gosh, what a cool topic to be able to dive into because I think that the hype around these has been just the weight loss, but there's so many other health benefits.
And there's study. We can pull up some studies, maybe even. I'll get my laptop out. But we could get peppered with like, hey, there's a new study. Hey, somebody just found out this. And so we'll get into that a little bit. Before we get started, remember this is for educational and informational purposes only. We strongly encourage you to seek the care and consultation with your medical provider before starting any weight loss program, exercise program, supplements, or other medication. With that, we'll get into it. Last couple weeks, we had Cliff Holt. That was awesome.
Was great.
Talking about pharmacies, GLP-1's history. They do not come directly from Gila monsters.
Every time I talk to Cliff, I've talked to Cliff several times on podcasts and things like that. Yeah. Every time I talk to that guy, I feel like I learn. It's just like going back to school. He just has so much information.
Super smart.
From a medication standpoint, from that pharmacy standpoint. So it's really awesome having him on. I'm sure we'll have him on in the future to discuss other things.
Well, I loved how he talked about like really, we talk about compounding pharmacies like they're some new thing or they're the trendy thing, but really they are the relics of the origin story of pharmacies, right? The apothecary is the guy who mix all those stuff up, and it really is a personalized, individualized, meticulous, deliberate process to help people get the effects and response that we want from some
particular dosing. Yeah, right. I mean, and even sometimes things that just really aren't made in big, for big box pharmacy distribution. Right. Some people just have individual needs, individual diseases that require customization, and that's where compound pharmacies come in. And it's, I think it's awesome to think about like compound pharmacies were the OG. They were the ones that were actually like, that's what a pharmacy was, is you worked with a doctor and a pharmacist to be able to come up with these formulations. And now they're looked at as like kind of more, these specialty pharmacies that are not really familiar to most people. And that's really just not the case. The truth is that they are the ones who actually were the OGs of pharmacy, and these big box pharmacies, which we all have become accustomed to and have their place in medicine for sure. They're the ones who are actually just more new. They're the ones that are not, haven't been around for as long.
Right. So talking about that and different things, one of the things we wanted to talk about tonight is we've been talking a lot lately about the GLP-1 medicines, the semaglutide, tirzepatide, your Wegovy, your Ozempic, your Zepbound, and how people use those for weight loss and how that kind of came about. They were originally diabetic medications, and it was discovered, that the biggest side effect of this is weight loss, and now they're like all the rage, right? Well, it's like on the weekly, it seems like there's some new study, there's some new thing, there's somebody who discovered another thing. I mean, there are studies after studies all over the world. We'll talk about one from Spain, from Malaga, Spain today, but that are showing more benefits. It's not like, hey, we have this diabetes medicine and we just discovered that like everybody that takes it loses a bunch of weight. But that same process is happening, but with cardiovascular system, kidney health, liver health, gut health, mental health. And so we wanted to kind of dive in some of those today and see about some of these non-weight loss benefits that continue to be researched and are constantly being kind of discovered more and honed in on a little bit.
I talked to a pharmacist that I work with in the emergency department with me and Rick work with. And, he, when the GLP-1s first started coming out, he knew that I had dealt with these medications for a little while. And that was when they were kind of still a little bit on the weight loss front, still a little bit more like, hey, what's going on with these? And he said, he's like, I would have patient after patient come in that would have some kind of disease process that brought him to the emergency department. And he said, they reconcile medications in the ER. And he's like, I would reconcile their medication list. And I would immediately see that, they're on a GLP-1. So then he'd say, well, I wanted to kind of prove that, some of these problems coming into the ER. Well, like that's why they were coming in.
That's why they're coming
He's
in.
like, so I'd start diving in. Oh, this patient's here with kidney failure. Oh, I see that they're on a GLP-1. So he'd go diving into the research and seeing what he could find. And, you know, he never told me he was doing this. He told me after the fact, he said, you do a lot with those GLP-1s? And I said, yeah. He said, you know, I've been kind of telling me what he's been doing with all these patients. Oh yeah, they're on a GLP-1. Let me see if this is what caused their disease.
Yeah, right.
And he said, to my surprise, every single time I look at what they're here for and that they're on a GLP-1, it's actually the opposite. Everything I'm finding in the research, and all he's looking at is you know, he has no bias. He's just like looking at kind of for the negative.
He's
actually
trying to find.
Yeah, he's actually trying to find. And
bad.
he's like, every time they come in, and I'm like, yeah, this is probably their issue. He said the research would actually support the opposite. That, oh, this helps with cardiovascular function. This helps with kidneys and liver and all these things that people would come in for. And he's like, I'm getting to the point where I'm wondering what these things don't fix, what they don't help.
Right.
And it's funny just to hear his perspective, not coming from that background, and him like really trying to dive in and kind of find the negative in these, and him continually just keeping on coming up with the research. He's just using the very scientific approach, looking at the research that's available, and he just can't find, he's like, they help with this, and they help with this, and they help with this, and all these things that typically we're trying to keep people out of the ER for. He's like, a lot of these things they help with. So it was just, that really opened my eyes when we had that conversation about like kind of the perspective of the people that don't live in this world, and even medical people that really don't dive into the GLP-1s, and how their education, because this is also relatively new, their education when they went through school, when he went through pharmacy school, these weren't really a big topic of discussion.
Yeah. Awesome. So, okay. I'm gonna change this format.
Yeah.
We're gonna have a laptop for a second.
Grab the laptop. We got a lot of awesome.
I pulled up a couple of things.
Rick has a couple hundred on his laptop of like studies and just things.
Director. So I pulled up a couple of these. So let's talk with cardiovascular health, right? Yep. Like anything you want to say, just introduce that.
Well, the biggest thing is that we know weight loss helps with the cardiovascular system. There's that's not a secret. That's been ongoing and known amongst medical professionals and regular people not in the medical field for forever. What we were surprised to learn is how much it helped when you were losing weight on a GLP-1, or even not losing weight, you were just on a GLP-1. That's actually what's interesting about these studies is far beyond even the weight loss. They found that the GLP-1s are significantly helpful in reducing cardiovascular risk. So let's talk about what that is. That's stroke, that's heart attack. Mm-hmm. We were even reading a study together that we were surprised that it actually helped shape the heart, like the LV, so the left ventricle. This is obviously the main worker of the heart, the one thing, the kind of the last stop before the blood goes out to your body. That it can reshape and actually reduce the size of the left ventricle. Right. For anyone that doesn't know, that's a good thing. Right. And we just were fascinated by all the different benefits. So, okay,
so I'm pulling up this one now. This is a study out of Malaga, Spain.
Yeah.
Okay, and this is just last year. So this was done. This is the title of this is called "Semaglutide May Cut Cardiovascular Risk Before Weight Loss." So they did the big study, and essentially, the takeaway home is that people who started semaglutide within the first 6 months of taking it, there was a 41% reduction in major adverse cardiovascular events, is what they called it, and there was significant benefit seen by day 20, and at 6 months there was that 41% decrease. Now, the thing that's interesting about that is that first 6 months where there's this huge reduction in cardiovascular events, like 53% reduction in cardiovascular death, 43% reduction in non-fatal heart attacks.
My goodness.
And that's before patients were seeing significant weight loss, right? Like the first 6 months, it's kind of the second 6 months or the next year, like where you really see some of that weight really coming up, because you're ramping up this just small dosing. And so that's I think the takeaway on this particular study out of Spain is that there's a significant reduction in cardiovascular risk even before you lose weight on the medicine. Like fascinating to me.
Fascinating. I mean, and it really just kind of shows you kind of what's coming. I mean, the GLP-1s, I mean, peptides have been around for a little while, but GLP-1s, as far as that peptide goes, I mean, they are just barely cracking the door down on these things, like where they're just really, I mean, having that much benefit in reduction of cardiovascular disease before you've actually even lost any significant amount of weight is huge.
Right.
I mean, it's just that's kind of goes to show, once again, we know that
it kind of demonstrates that a lot of times the way in my pea brain, sometimes I think about this is, well, sure, you lose a bunch of weight and a lot of these secondary things are going to get better, but this is actually information data that shows these are direct benefits
of the medication
that aren't just a secondary kind of side effect of losing some weight. I mean, there's good with that as well, but this is just a separate total benefit.
Yeah, it's really fascinating. And you see it. I mean, you see it in clinic, right? You start talking to these people and they're feeling better and their outcomes seem to be better. It's hard though to take the anecdotal stuff in clinic and you know, kind of put it all together, because it's really just more observational. These studies are the opposite of that, right? They just take the science and they put it all together, and this is how we get medical information. It's so fascinating that they're able to take this information and kind of put all together what we're observationally seeing in clinic and then putting it in a study, and it's doing exactly what we kind of thought it was doing. But before, it was like we didn't really have the evidence to support it. Now, with all the studies going on with this, we have, like, we're getting overwhelming amount of evidence that this is a significant reduction in this. I mean, it's to the point now where I suspect our next competition for GLP-1s, as far as prescribing them, are going to be cardiologists.
Right.
I mean, it's going to.
I am not going to be surprised if this becomes a staple of cardiovascular health.
Sure.
In a cardiology clinic. It just, there is just so much benefit.
Too much overwhelming evidence. It's interesting, the shift that I've even seen in the 5 years I've been doing my weight loss clinic, and then adding in GLP-1s. At first, it was everyone, primary care providers, cardiologists, saying, oh boy, you know, people would come in and get on them and they'd be like, oh boy, be careful, be cautious. You really ought to look into that. That's not going to be a good thing. You're going to, you know, lose a little bit of weight, but it's not worth it. And interestingly enough, now I get referrals all the time from primary cares and cardiologists. Yeah. And anyone that tells me they go see their cardiologist and says, hey, I told my cardiologist I'm on a GLP-1, and before it was met with like, oh boy, you better be cautious. And now it's met with like, that is fantastic. Good for you. And it's so interesting, because as this data comes out, as the research that we're talking about, and we'll talk about a bunch more, it's interesting to watch the medical community get this information. And they're like, oh, this isn't a one-off study by the manufacturers of the medication. This is study after study after study, non-biased, you know, these double blind. I mean, they do all the things, and they're just finding really good information.
Yeah. So hearts are healthier.
Yeah. Okay. I mean, who doesn't want that?
Well, all right, let's talk about kidneys.
Yeah.
This is another study. This is the one. So this is, excuse me. This is talking about Ozempic. This was released about a year ago in the FDA. This is just a kind of a news story about the FDA has approved semaglutide for reducing the risk of worsening kidney disease and cardiovascular death in adults with type 2 diabetes and chronic kidney disease. So this was an international study. It's called the FLOW trial. It involved several thousand individuals. And essentially what it achieved, the endpoint was a significant 24% relative risk reduction of kidney disease worsening. So if you have kidney disease, 24% reduced chance of it getting worse.
Yeah.
Right. End stage kidney disease developing and death due to cardiovascular disease. These were the endpoints compared to the placebo that was 4.9% at 3 years. So 24%, it's like a 20% hard reduction.
For anyone that doesn't know, that 20% kind of sounds like a very small number. You're like, 20%, what's that? I mean, when you work in the medical field, 20% of anything increase or improvement in any area is massive. It's a big deal. I think what's interesting to point out about this is that, to back up a little bit, diabetes is so tough. It's tough on a lot of the parts of the body, you know, the heart and we could go on and on and on. But the kidneys in particular, we see a lot of diabetic patients that end up becoming having renal disease or significant end stage renal disease, and that's the kidneys. And so to watch this reduction in these patients, to watch that this can be kidney protective or renal protective is so cool. And we kind of knew a little bit about this, right? We know you get your diabetes under control, that is going to help the kidneys. But when you start seeing that this is it's better than just getting your diabetes under control. The medication actually has a direct effect on the kidneys. As a noted side effect of these medications, oftentimes it was noted in the first studies that renal failure or acute kidney injury was noted as a potential side effect. So you're like, wait a minute, I don't get that. They said it could affect my kidneys in a negative way. How's it helping them? Most of this is what I can draw out anyways from what I've read, is that it was the studies have to take every side effect that happens during the studies.
And mention it.
Yeah, they have to say it. So this wasn't significant, but what it was is that a lot of these people were dehydrated, right? GLP-1s slow down gastric emptying. A lot of people just weren't drinking enough water on these medications. We know that dehydration under any circumstances eventually is, and probably the number one reason we see acute kidney injury in the ER is dehydration, right? So that was more related to that. But of course, when done under the studies and people are not drinking as much water, then they get dehydrated, they get acute kidney injury. So when and if you ever go on these medications, and if they talk to you about the potential for kidney failure or kidney disease, well, the big take home point is what we've talked about a bunch, and that's just stay hydrated. And the looks of it are that these are actually kidney protective along with staying hydrated. So,
okay. How about joint and bone health?
This is a new one. I mean, you kind of brought this up to me after I had read about it, but then you brought it up first. So dive into the new indications.
Well, so the FDA has a new approval. So it's one of these things that we found out, hey, by the way, this affects so much that this is actually a reason to prescribe the medicine, right? The FDA says that. So tirzepatide has been indicated for the treatment of osteoarthritis of the knee. And what that is that's worn out knees. Right.
So anyone over the age of 60, pretty much.
or not even that.
Or 50. 50 or 40 in the military.
If you've ever carried a rucksack.
Yeah, you're going to have some.
But I mean, so there's a couple things. And again, this is one of those things that intuitively you think, well, yeah, if you are heavy, that's more wear and tear on your joints. And that's a true statement. But there are specific and direct anti-inflammatory effects of these medications that go beyond just taking weight off. So both of those are benefits. I mean, if you weigh 50 pounds less, that's 50 pounds every step that you're not grinding on your knee. But there's also specific and direct anti-inflammatory effects of these medications. It promotes vasodilation. It reduces arterial stiffness, oxidative stress. There's a clear anti-atherosclerotic effect that helps blood flow. So there's just some really good benefits of that, and that's something you think of. Oh, it makes my knees better.
This makes sense. I mean, and me and Rick could have probably told you that we knew that there was an effect here. I mean, patients talking about their joints ache less. In fact, I had a patient that lost all their weight on a GLP-1. They got off they would say, hey, I want to see if I can maintain on my own. No worries. I support that. They actually ended up rescheduling about 6 months later. And I'm figuring, hey, they must have started gaining weight again. They wanted to get going on this again. And actually what the conversation was, hey, I've only gained about 5 pounds back. I'm actually doing pretty good. They're like, I actually want to get back on because I did not realize how much my joints were aching, in the morning. And then when I was on the medication, that completely went away, and I got off the medication and my joints started aching again, just kind of achy, just kind of like that. I just have lived a tough, ongoing life. And they're like, I get on this GLP-1. So it's interesting. They just wanted to go on a low dose to not only maintain their weight. They thought that was going to be a great benefit as well, make it a little easier on that front. But really, they got back on it for achy joints.
Achy joints. Well, in any some of these other studies in the New England Journal of Medicine, it talks about this, the knee osteoarthritis one. But there's other similar studies that have been shown. And one of the things, like, for example, patients with psoriasis have been shown improvement. So really the thinking is any of these chronic inflammatory conditions seem to be improved.
We've seen some of these autoimmune diseases that tend to run rampant. Once again, this is more anecdotal. There are some studies starting to come out about this, so I don't want to overstate it. It's more, once again, just observational in clinic, but it's at the end of the day, seeing some of these autoimmune diseases I've seen some people with Hashimoto's and things like that were on thyroid medications and they just couldn't get it under control. They get on a GLP-1 and next thing you know, they're like, look, I just stopped my thyroid medication. My thyroid's been doing great. And actually I'm not having any of the effects I was having before of Hashimoto's. So, I mean, once again, I'm not claiming that this is a fix for that. What I am saying is that when you start to see something in clinic over and over again, the studies are going to follow. Like we will see a study on autoimmune disease,
right,
and the effects on that. And I mean, for anyone that lives with an autoimmune disease or knows someone with one, I mean, boy, these can be debilitating, lifelong, horrible diseases. If you think you can get a little bit of help with that beyond these biologics that are brutal to the, not only they're brutal on the pocketbook, you think the GLP-1s are expensive, go look up the biologics that are used in these autoimmunes. They tank your immune system. They do all kinds of things.
Feel horrible.
To think that they could get some help with a GLP-1, I mean, it's exciting to see that.
Yeah, 100%. Okay, let's move forward to psychiatric disorders.
Yeah,
addiction and psychiatric disorders. So you've talked about before. You've mentioned about like the equivalent of a low dose antidepressant medication.
There's a lot of studies that would support that. And I think we were reading one earlier, but it was that actually some people are finding that this, the mood lift, right? We know it works on the dopamine, the GLP-1s work on the dopamine a little bit in the brain. So, anytime you're messing with dopamine, you can have effects. Now, I think that we should, to be totally objective on this, it's hopefully it's good, right? Hopefully it's a lift. Hopefully it helps with whether it's some mild depression or anxiety or whatnot. Now that means that anytime you can adjust dopamine, that means that it could downregulate or downshift the dopamine a little bit. And so you could obviously worsen depression. But the studies so far are showing a more positive benefit than a negative. Anytime you're losing weight, you can actually have some depression. They find most people actually lose weight and feel better and mentally things are better, but there are a small amount of the population that actually tend to have a more depressive effect with their body changing, with losing weight. We're not 100% sure, and hitting on those dopaminergic receptors in the brain that can affect mood. And what we're seeing so far, I think, is mostly positive.
Yeah. Well, and so you talk about dopamine. So the GLP-1 medications, they modulate the brain's dopaminergic reward system. So that's how like a lot of drugs work. Right. Is they work on that dopamine in the brain. And so what happens is the GLP-1s directly affect that system thereby reducing cravings for addictive substances such as alcohol and drugs. Right. So there's been studies that have shown some semaglutide leading to a lower incidence of alcohol abuse or relapse in individuals with alcohol dependence. And that's likely due to a reduction in the positive reinforcement of that whole system. So that's sparked interest in treating all kinds of other disorders, potential. I mean, that's how now other questions are being asked, like, hey, we got to do a study on other psychiatric disorders, on mood disorders, on depression, because we're seeing this direct effect that is showing how, for example, alcohol abuse is decreased, relapse and things like that.
And I've seen this in clinic. I mean, it's definitely something that kind of surprised me initially when prescribing GLP-1s. It was not an effect I was expecting. I was expecting an effect on obviously cravings and appetite as it relates to food. What I wasn't expecting is how much it affected people on alcohol. People that told me, hey, look, I just wasn't straight up with you when I first met with you. I told you I had a couple social drinks a week, and it actually was like every night, and I was drinking not 1 bottles but 2, and they're losing weight and they're having success. And actually the thing that they're most excited about short of all that is they're like, and look, I don't want to drink anymore. I'll pour half a glass of wine and I might get a few sips in, and I'm just kind of uninterested. And when you see that, and then you see that like they're losing weight, which is probably in large part to do to them not drinking as much alcohol, that's going to be a big one. But also just the fact that they feel like they actually have a choice in this. Like anyone that's ever dealt with addiction, I mean, that they feel like they actually feel like they have a little bit more control back in their lives. I do think the studies for this are going to be coming. I think there's going to be a lot of them. I think you'll have GLP-1s that are specifically targeted for this group of people that want to work on addiction, whether it be drugs or alcohol, because we know those effects. I think it's going to be really, really awesome.
Yeah. Well, there's other studies too, looking at the effects on the brain, and probably looking more in the long term, but there's also quite a bit of suggestion at this point, or speculation, that things, neuroinflammatory disorders like Parkinson's disease or Alzheimer's disease may be affected. There's actually some phase 3 clinical trials that are looking at the effects of on these types of things that reduce the plaques in Alzheimer's disease, improve cognitive function. They protect the dopaminergic neurons in Parkinson's disease. So a lot of these kind of chronic degenerative neurologic conditions that we associate with aging frequently. I mean, those studies may take a long time, but
they will.
I am not going to be surprised if in 20 years some of these studies that are underway are going to say, you know what, we have really found a reduction in the risk of developing Alzheimer's and developing Parkinson's disease or worsening those conditions. It's fascinating how much this affects that.
It is, yeah. We know that, and we know even, obviously not fully always understanding the direct effect of medications on those things. I mean, we know just simply losing weight, getting your insulin under better control, insulin and sugars under better control, I mean, are going to affect it. Just let's pretend for a moment that the medication itself had no direct effect on these things, but you just were able to like lose some weight and have all these indirect effects of like getting your sugars and insulin and all that stuff under control. We already know that those are going to have a positive effect on the kidneys and the heart and the brain. And I mean, there's already a bunch of studies that support that. So you could almost make these claims beforehand, knowing just the effects it has on the body. But now we're just finding all these additional things that I don't want to say were totally unexpected, but kind of unexpected. We just thought that it was going to be more about initially getting diabetes and insulin under control, as well as, maybe some weight loss benefits, because everyone in the studies lost weight.
Right.
And so we kind of knew that was going to happen. And now it's just turning into so much more than that. And that's why we wanted to discuss it.
Yeah. Ton of benefit. Great. Yeah. I think it's fascinating and just so much potential yet to be discovered.
Yeah. So there's a bunch of other subjects that we'll go into with this. I mean, there's always going to be emerging data. And like I said, Rick has a whole laptop full of hundreds of studies that we always like to look at the science and see where things are going. But it's, these are just some of the main benefits that they're coming up with now in the really long but short time this medication has been around. It's been around. We know, we talked with Cliff, it's been around for a while, but we do know that it's just more at the forefront now, because as these GLP-1s have changed over time, and they're finding that, oh, hey, if we move this chain over here or the tail over here, then it can extend the half-life and do all these cool things that we weren't expecting. So as these medications evolve and as they frankly get better, they're going to find that they can have more benefits with less side effects. I think we're just going to see more and more studies that support even people that are not overweight using maybe even microdosing these medications for a host of other things. Anti-aging kind of fad right now of like everyone trying to live longer and be healthy.
Never age another day in my life.
Yeah. I don't know if I want to live to 120. That just doesn't even sound fun.
Motion is lotion.
I guess we could transition and talk about the vitamin. We always like to do a vitamin or supplement of the week, just to talk about something.
Okay. So this one. So when Greg and I started kind of brainstorming and decided we want to do this, we came up with we wanted to provide some supplements that we believed in and that we thought would be helpful. So we kind of put together, sourced some stuff, and we kind of have our brand, the WeightWise nutritional supplements. And that can be at getweightwise.com. Welcome to go there, buy stuff, get it. We think it's good stuff. If you've got something that works, great. That's awesome too. But I wanted to talk about this one. This one today just hit home. The hair, skin, and nails essential. And this is a mix of like vitamin A, D, E, C, a bunch of B vitamins, and then some other, interesting stuff. But it's anyway, the design hair, skin, and nails essentials. This is like for hair and nail growth. Okay. So this came out when we were kind of putting together what we thought would be helpful to have as a selection of nutritional supplements. We want a multivitamin with this, the other. My wife actually was the one, she's like, you need something for fingernails and hair.
Yeah.
She's been on a GLP-1. She's like, my hair's getting thin. I'm menopausal age, and my nails keep breaking. And then the nails were driving her nuts. She'd go get her nails done, and then like the acrylic or I don't know, whatever they do, fall off or break. And she's like, my nails they're so weak. I can't hold this stuff. And it was frustrating her to no end. So she's like, I need hair, skin, and nails. So we have the hair, skin, and nails. And so I'm like, well, take it, try it. Try it. So she's been doing that for a long time. And just this morning, I was getting ready and I had this bottle, and she says, oh, because I'll tell you why. It's because we are, it looks like we've sourced a way to have the hair, skin, and nails. We have it in a capsule, but we're going to come out shortly with a gummy.
With a gummy
version of that.
Some people just don't like taking capsules. So we were like, hey, let's get them a gummy form.
We're trying to find, we had a gummy multivitamin, and we're trying to resource that because it kind of petered out. So we want to have a good source for that. Yeah. So we're working on that, but we do have an upcoming hair, skin, and nails gummy as well. Same kind of thing, just in a gummy form. So I mentioned that to her. She's well, it works great. Honestly, I've been taking this. It's just, I feel like I need to get my nails done more frequently because they're growing so fast. Yeah. Like they're stronger. They're growing. Like I was like, really? She's like, yeah, it's working like a champ.
I hear it in clinic all the time. Actually, probably the number one, I hear it from men, but I hear it a little bit more on the women's side, especially women getting into that perimenopausal or even postmenopausal state. Like, because already naturally our bodies are like, the nails are going to get more brittle. The skin's not going to be quite as robust, and those cells don't replicate as quick. And then hair, right? Like women's hair thinning. It happens naturally. It amplifies with weight loss, and it not for everyone. Some people do just fine. Other people, when they lose weight, unfortunately, your body kind of, you're in a calorie deficit. And so that's why we wanted the supplements, because as Rick coined a long time ago, we want you in a calorie deficit, not a nutritional deficit. So sometimes when you take down calories, sometimes you're just not getting all the nutrients you need. So we wanted to have this one. And the reason why is because in clinic all the time, I hear my hair's thinner, my nails are getting more brittle, things like that. So they're loving the weight loss, but they're not loving some of these effects from that weight loss can have. Yeah. And so I hear it all the time now that we've had this out long enough, and I've had several people try it. Just a patient yesterday. Hey, I have all these new little frillies.
New growth.
Yeah, new growth. They're like, yeah. And so I'm like, they ended up purchasing more and getting going on that. And they're just saying they wanted to stay. So I know. Had I only known about this. Had I only known about 20 years ago. Yeah. So
it's amazing though. I mean, again, this isn't a study like we've been talking about. This is like anecdotal stuff. Like people that we know have done this. Have said, "Hey, this really is amazing. It's helping me a ton."
And there's a lot of products out there. There's tons of hair, skin, and nail products. The thing is that like even I'm not going to mention their names. I don't know if I can, but there's a really popular one. But you're spending $200 or $300 for a 3-month supply. And it's a fantastic product, but $300. You're not going to spend anywhere near that on our website for this. And especially if it works. Yeah. And, frankly, it has a lot of the same ingredients. So the truth is that any of your supplements, like we can't necessarily stamp our medical endorsement on them. We can just take what's available out there and try to just put together as good of a supplement list as we can. Yeah. So Get Weight Wise.
Hair, Skin, and Nails is on getweightwise.com.
We have, if you're like, I'm not sure what to take. Like, I'm not sure what to take. We made bundles. So if you're on a GLP-1 already and you're losing weight, you can go on there and get the GLP-1 bundle of what we recommend there. Yeah. Or if you're just looking to optimize your women's or men's health, like to help with hormones and just help with all that. I mean, we have these bundles that we already built on there that says, hey, look, these are kind of the
3 or 4 things that we would recommend in that situation.
Right. So, and you're not going to spend your entire monthly earnings on supplements, because we don't really think that that's the answer there. We think just a good solid supplement.
Solid supplement. Yeah. So,
I think that's a good one to bring up. It has a lot of the stuff, biotin and other things that are so important for good hair, skin, and nails. So, I'm glad that we're seeing the effects of that.
Okay, so we even have, I can't even read this stuff, it's so small. But I mean, there's actually some proprietary things on here about P-amino benzoic acid and bamboo extract and stinging nettle. And like there's some plants there. I mean, there's some smaller ingredients on here that I don't know if that's what's making it work, but I mean, it's been a fabulous thing for several people that we know. So
yeah, we really like that one. So that is your vitamin or supplement of the week. Yeah, if you're dealing with that, whether it's from weight loss or just naturally from aging, we do find that this one in particular, this kind of formulation has been really effective. So go pick yourself up some.
Yep. GetWeightWise.com. And tune into our episodes. You can get us on our YouTube channel at Support My Weight Loss or at supportmyweightloss.com. There's a live stream page with a link to all of our previous videos.
Yeah.
And we're going to get some more stuff on here soon. But I think that's good for tonight. Remember, advice and relationship with your medical care provider is always recommended prior to starting any supplements or weight loss program or medications. Our information here is educational and informational only, not intended as medical advice. With that, we'll tune out and talk to you next week.
Yep. See you then.